In which country was COVID-19 first reported? Options are, Option A is America, Option B is Iran, Option C is Italy, Option D is China. The correct option is Option D. What is COVID-19? Options are, Option A is name of the virus, Option B is the name of the disease, Option C is the name of a drug, Option D is a place in China. The correct option is Option B. Which virus causes the disease COVID-19? Options are, Option A is SARS-CoV-2, Option B is SARS, Option C is MERS, Option D is Nipah. The correct option is Option A. How can we make our hands safe? Options are, Option A is wash with soap and water, Option B is wash with plain water, Option C is wipe hands with tissue paper or cloth, Option D is wash with soap and water and scrub at least for 20 seconds. The correct option is Option D. What are the methods to prevent COVID-19? Options are, Option A is physical distancing 1 meter, Option B is physical distancing 2 meters, Option C is physical distancing 6 feet, Option D is both 2 and 3. The correct option is Option D. Who is at a higher risk of developing complications from COVID-19? Options are, Option A is elderly above 65 years and above, Option B is people with uncontrolled diabetes, Option C is people with other pre-existing diseases, Option D is all the above. The correct option is Option D. Who conducts scientific research about diseases like COVID-19? Options are, Option A is epidemiologists, Option B is public health specialists, Option C is health data scientists, Option D is medical doctors, Option E is scientists, Option F is all the above. The correct option is Option F. Name a clinical trial in which blood is transferred from recovered COVID-19 patients to a coronavirus patient who is in critical condition? Options are, Option A is plasma therapy. Option B is Solidarity. Option C is Remdesivir. Option D is hydroxychloroquine. The correct option is Option A. What happens to a person suffering from COVID-19? Options are, Option A is around 80% of the people will require no treatment as such and will recover on their own, Option B is around less than 20% or a small proportion may need hospitalization, Option C is a very small proportion basically suffering from chronic illness may need admission in an intensive care unit, ICU, Option D is all the above are correct. The correct option is Option D. Mild symptoms of novel coronavirus are, Options are, Option A is fever, Option B is cough, Option C is shortness of breath, Option D is all the above. The correct option is Option D. From where coronavirus got its name? Options are, Option A is due to their crown-like projections, Option B is due to their leaf-like projections, Option C is due to their surface structure of bricks, Option D is none of the above. The correct option is option A. The first case of novel coronavirus was identified in, options are, option A is Beijing, option B is Shanghai, option C is Wuhan, Hubei, option D is Yanjing. The correct option is option C. Coronavirus cannot be transmitted in areas with hot and humid climates. Options are, option A is true, option B is false. The correct option is option B. How long is the average incubation period for novel coronavirus? Options are, option A is 5 to 6 days, option B is 2 weeks, option C is 1 month, option D is 1 day. The correct option is option A. The average incubation period, the time between infection and the onset of symptoms, for COVID-19 is estimated to be about 5 to 6 days. Antibiotics can treat novel coronavirus. Options are, option A true, option B is false. Antibiotics do not work against viruses, and the novel coronavirus is no different. There is currently no specific medication to prevent or treat COVID-19. Medications to relieve symptoms may be recommended.